And about halfway through my time there, I realized, woke up one day and found that I was not in very good health or shape myself. I was about 30 pounds overweight,
Mm.
felt like crap, wasn't sleeping well, certainly wasn't eating well or working out or training or doing any of the things I was supposed to be doing. And what was eye-opening for me more than anything was the fact that he didn't have many answers for me other than just simply lose weight, exercise, eat some vegetables, and put you on a statin if your lipids don't get better. Holy cow, I found, first of all, my passion for medicine again because I was really getting frustrated and disillusioned with urology and the bureaucracy, the BS that goes along with running a practice. And so I did what, any sane doctor would do, and I just quit. I jumped off a cliff and I said, "I'm leaving urology and I'm not looking back." And I canceled all my insurance contracts. Man, it's all about just following your heart and your passion and finding what you love to do.
One thing is talking about is this dichotomy between the longevity and there's this battle with the existing medical industrial complex with the insurance. They're like, this doesn't work, and then
Mhm.
it's actually
Yeah.
working.
And looking at our healthcare system today, how broken it is, and it's all about just treating diagnosis with drugs. And these doctors are miserable, patients aren't getting results, prices keep going up, and it's just getting worse. And I just think it's failing. And recent studies have shown that for the first time in a long time, lifespan is decreasing. We're dying younger. And
Mm,
so I think it's very clear that what we're doing isn't working. Bob Harper had a massive heart attack, almost killed it.
mm, mhm,
His issue was massively elevated LP little a,
mhm.
not a lab that's typically ever checked by primary care, not allowed. Genetics can help us. Functional testing, looking at the gut. Geez, how many times were we taught in medical school or residency or training, Chris, about the microbiome? Never,
Right.
never. But the microbiome controls everything. Stuff like that you'll never find in traditional healthcare that makes all the difference in the world for these guys. And I hate going on Twitter and Reddit and seeing all these people battling over the perfect diet or perfect supplement stack or this or that. It depends on your testing. We can track blood sugar with CGM blood sugar monitors, not just for diabetics anymore. Very common for primary care to just check total. A caveat here, the reason I'm bringing this up is when you look at the lab slip, the right side of the page has a reference range, right? And everyone looks at that reference range. Even doctors look at the reference range. And if you're in that range, you're like, yeah, you're fine, you're normal, you're good, no problem. Which is bullshit. Excuse my language. It's bullshit because it's important that people understand what that reference range means. Testosterone levels are half what they were 20 years ago. So therefore, if you think about that reference range now with that perspective, that reference range is literally half what it was 20 years ago. And so this is a really important point for men. Is this talks about taking control of your health and not falling for this broken healthcare system that we're stuck with. You don't want to be at that low range. Thyroid is an underappreciated hormone for men. It's not just for women. It's important because it affects energy systems, metabolism, weight loss, mood, etc. They never teach you this in medical school, but methylation is a very important process that happens in every part of our body, and you can assess that based on homocysteine levels. And sometimes just diet can correct that. And you look at most lab panels that primary care is doing, and they're just barely scratching the surface, honestly.
Mm,
You look at the rise of cardiovascular disease since the 1950s, very clearly parallels, identical correlation between the increased use of these seed oils and cardiovascular disease. What most people need to focus on is 1 gram of protein per pound of body weight.
mm.
And so for men, that's 160 pounds, excuse me, 160 grams of protein a day. Dehydration is one of the most common cause of low energy. And when you drink more water, you tend to eat less food as well. I go through a high performance health handbook that goes through 15 strategies that you can start to leverage today to have more energy, have better sex, and live longer.